Good afternoon, and thank you for joining us. We're holding today's briefing at the State Emergency Operations Center here in Springfield. Standing with me today are Sangamon County Board Chair Andy Van Meter, Sangamon County Public Health Director Gail O'Neill, and Department Chair Dr. Brian Miller, Illinois Municipal League Director Brad Cole, as well as the state agency directors that are leading our COVID-19 response, Dr. Ngozi Ezike, the director of our Illinois Public Health, and Illinois Emergency Management Agency Director, Brigadier General Alicia Tate-Nadeau. I want to start with a reminder that we have our COVID-19 state hotline number that people should know about now, available in English and Spanish, and Polish and Mandarin will be up by the end of the week. To help answer any questions that people may have, I want to remind you of what that number is, and I would ask you to publicize that if you would. The number is 800-889-3931. My administration created this hotline for the same reason that we launched these daily public updates. It's our priority to communicate with you regularly, responsibly, and honestly. These sacrifices are difficult for all of us, and to get through it, our residents deserve to be equipped with the most clear and reliable information that they can get. I know there are rumors flying around on federal and state action, and I encourage the press and the public to function with a heightened commitment to truth and verification in this unprecedented situation. Here in Illinois, you will be able to get all the facts directly from me and my administration at this daily press conference. Last night, the CDC announced its strictest national recommendations to date, advising against gatherings of 50 people or more for the next 8 weeks. There is new guidance out just moments ago from the President of the United States, and we can talk more about that in the questions and answers. But as a result of the guidance that's been given, I am mandating that any gatherings of the 50 people or more guidance by the CDC will be canceled. Illinoisans who can stay home should continue to do so. It is imperative that our residents take responsibility for themselves, their families, and their communities at this moment. As you know, at 9 p.m. tonight, all bars and restaurants across the state of Illinois will close their dining rooms to the public through the end of this month. This was a difficult decision, but it's what the medical experts and the scientists tell us that we must do to safeguard the health of the people of Illinois. My administration is working with restaurant associations and owners and food delivery services to find options to safely keep kitchens open for drive-through, for curbside pickup and delivery during this period. I know that there are Illinoisans all across the state who get their paychecks from bars and restaurants. My administration has expanded unemployment insurance to cover individuals without access to paid sick leave or who are unable to work due to COVID-19. I have also directed my administration to do everything in our power to provide assistance to every resident who needs it, including seeking a moratorium on utility shutoffs for residents who can't pay their bills during this period, and filing a federal waiver to expand Medicaid. Today also marks another hiatus that's an important part of our effort to curb the rates of COVID-19 spread. This is the last day of school for our K-12 schools across the state until March 31st. We must protect our children and their parents, as well as the educators, administrators, and staff people who work at our schools. And since each of them can also be a carrier of COVID-19 back home if they become infected in school, we needed to stop people from bringing the virus home with them. Yesterday, members of my staff and the Illinois State Board of Education held 6 hours of tele-town halls with our 852 superintendents from across the state to answer questions and work through any remaining challenges.